So moving on, we're going to talk about mycoplasma. Mycoplasma, we've mentioned already, as a causative agent of walking pneumonia. These are the smallest free-living bacteria. So we can grow them in a culture dish. They're not obligate intracellular. Here's the kicker again for mycoplasma. There is no peptidoglycan in the cell wall. So when we were talking about cell walls very early on, I mentioned mycoplasma. And I said, more likely than not, if you're to get a question on mycoplasma pneumonia, I can almost guarantee they're going to ask you a treatment. And on the distractors, you're going to see lots of penicillins, lots of cephalosporins, and then you'll see erythromycin. You'll be like, erythromycin for respiratory? Really? And you're going to have to pick up that it's mycoplasma and there's no peptidoglycan in the cell wall. So that is important. Now, fried egg colonies does occur with culture of some of the mycoplasma species, but not mycoplasma pneumonia. So we're going to look at some other things for diagnosis of mycoplasma pneumoniae. We're going to talk about mycoplasma pneumoniae first, and then we'll finish up, believe it or not, our talk of the bacteria with ureaplasma ureolyticum. They're both really in the same family of mycoplasma. Now, the mycoplasma, again, is a respiratory pathogen. We talked about walking pneumonia. This is probably the most common cause of walking pneumonia. Very, very common in children and teenagers as probably the leading cause of walking pneumonia. How is it transmitted? Again, it's walking pneumonia. What does that mean? That means you walk into school, you sit down, you have a dry, hacking cough, and you spray that respiratory droplets on everybody sitting around you. Now they get sick. So it spreads very easy when you're in close kind of living quarters or close classrooms. Military recruits tend to get this as well. And in college dorms, it spreads very, very quickly. Now, as far as the pathogenesis is concerned, if you look, there's not a whole lot here, but we cause ciliostasis again. So what's happening is we're attaching by the P1 protein, and we're attaching again to the respiratory epithelium, and we're stopping those cilia from beating. So now very, very sensitive to a lot of things that we breathe in. And just about anything is going to trigger that very dry, hacking cough that's characteristic of walking pneumonia. You also get a lot of inflammation and damage to the respiratory epithelium, again, which contributes to that dry, hacking cough. What's interesting about the organism itself is it does have super antigen-like properties. So you can get this overwhelming inflammatory response. And what you're looking at here, the cytokines listed, interleukin-1, interleukin-6, and TNF-alpha, are all what we call pro-inflammatory cytokines. So they're going to promote the inflammatory response, especially in a case of mycoplasma functioning as a superantigen. The disease we've mentioned, walking pneumonia, what is it going to present as? Pharyngitis, dry hacking cough, atypical pneumonia. That third bullet point is probably the most important. It's the most common atypical pneumonia, in addition to viruses, in young adults. So children and young adults, this is very, very common. So again, if we weren't to give you any diagnostic clues, just present with the symptoms. You maybe have a 15-year-old with a dry hacking cough, fever, pharyngitis, and I'll give you another clue. In a teenager, otitis media is also very common with walking pneumonia. Those symptoms, and they just say, hey, what's the most likely cause? Is Mycoplasma pneumoniae, all right, because it's more common. Diagnosis, not a whole lot here, all right, but I'll tell you one of the things that they may mention. You can look at all the different bullet points we have here, but go to the last one. Positive cold agglutinins. What are those? Those are antibodies that actually agglutinate in the cold. And while they're not specific for Mycoplasma, if you have the symptoms of walking pneumonia and they tell you that cold agglutinins are there, that is going to be diagnostic for Mycoplasma pneumoniae. Because cold agglutinins you can see in other diseases like autoimmune hemolytic anemia, just as one example. But again, you're not going to have the symptoms of walking pneumonia. So that's going to be a big clue for you. Treatment, again, no beta-lactams, no cephalosporins, no penicillins, and they will test you on that. They're going to ask you a treatment question. Prevention, we got nothing for Mycoplasma pneumoniae. Very, very contagious. All right, so then we're going to finish up our talk on the bacteria with Ureaplasma ureolyticum. It is under that same umbrella as Mycoplasma. Just a couple of things I'm going to point out to you about Ureaplasma. Number one, you might guess by the name that what is probably its most important virulence factor? Urease. You'd be right. Very good. So it is urease positive, which means it can cause renal calculi. One of the things, though, about Ureaplasma I'll mention here, because this is kind of another area that you might see microbiology tested. Ureaplasma tends to be part of the normal flora once people become sexually active. So, for example, once a female becomes sexually active, Ureaplasma becomes part of the normal flora. If you were to find Ureaplasma in the vaginal mucosa of a child, that might be indicative of some kind of sexual abuse. So it can go to a question not so much dealing with the microbiology, but if you know what is normal flora in sexually active adults, now you're seeing that in a child, you got to start thinking about some type of sexual abuse.